Hello and welcome, everyone. My name is Javier Santana.
And I'm Nathan McKenty. We're two current residents here at the U Miami Jackson PM&R department.
Yeah, we welcome you to Lynn Rehab Center.
And we're hoping that you enjoy your rotation with us. We're here to give you a brief introduction.
Okay, so just a few things about Lynn Rehab Center, or LRC as we call it. So first of all, we provide comprehensive rehabilitation and medical care for patients with traumatic brain injury, transplant patients, spinal cord injury, cancer, and many other complex medical conditions. We have and we conduct extensive clinical research here. We also have high-tech equipment and facilities, and we are part of the Jackson Health System, which is one of the largest in the United States and one of the most respected academic medical centers.
For those who may be from outside our specialty rotating with us, we're happy to have you too. I just want to give a little introduction to PM&R. That's physical medicine and rehabilitation. You could generally define this as the care and rehab of patients with major disorders of muscles, joints, tendons, peripheral nerves, and the central nervous system, particularly those that are disabling and may impair quality of life. There's a lot of different fellowships at PM&R, and as you can see from the list here, it really covers quite a wide range of different specialties, everything from sports medicine all the way to spinal cord injury, and everything in between, from cancer rehab to interventional pain management. There's a wide scope of practice, and that's both for inpatient and outpatient care, as well as consults. So there's a wide range of things that PM&R doctors do. It's hard to nail down one particular thing that defines us all, but it's one of the great strengths of our field, in my opinion.
So upon beginning your rotation, please get in contact with a resident clerkship director. This person is there to help you. Any questions regarding if you don't know where to go, who to contact, who your attending is going to be, please reach out to the resident clerkship director. If your school gave you some forms to be filled out for the rotation, please give them to the resident clerkship director, who in turn will give to Dr. Prince or the clerkship director to have those filled out. Any questions regarding badging, EMR access, or scheduling, please contact Ms. Carita Davis or Dr. Prince. We've provided your emails there. Also, there are two reference manuals, and you should find them in the 5th floor and the 1st floor workroom. There are the room numbers right there.
So these are some of the official learning objectives that you have for your rotation. They're kind of standard sort of things that you would see in other medical rotations, but in particular here, we want you to really learn the anatomy, physical exam, and care of patients with musculoskeletal conditions, spine disorders, and neurological disorders. That's really the bread and butter of our field. That involves both, evaluation, that involves prevention, and importantly, physical exam maneuvers. So there's a lot of things that you can learn while you're here. A lot of our field is stuff that you didn't spend a big dedicated block of time to in many medical schools. So there can be a bit of a learning curve if you're not familiar with it, and we look forward to teaching you.
Okay, so there are some expectations. In terms of dress code, please come in scrubs. We want you to be comfortable. You really don't have to bring your white coats. Just scrubs are just fine. Attend all your scheduled sessions. Please be on time and always demonstrate interest, motivation. Always be willing to help. That is looked upon favorably.
So one thing we do expect for all students who rotate with us is that you do a student presentation. This is pretty standard stuff, but it's just going to be with your attending and resident who's on your service. It's not something where you're going to be standing up in front of all the residents and faculty presenting. So don't get too nervous about it. Just pick a rehab topic of your choice. It should be about 10 to 15 minutes long. Discuss it with your attending and resident before you prepare for it, so that it's a topic of an appropriate scope and something that will be useful to bring to both your attending and your resident. The resident should be giving you some formative feedback on this. There's a form for this. There's an official form for this. Don't let them forget it because they probably will. The clerkship director can always send a new form out to them and you. When they're done giving you feedback in person on the presentation, they're going to have to give that form to Caritha because that form actually stays in your application file for us. And come interview time, if you're interviewing with us, we can always look back and say, hey, that's this is the presentation they gave, they did a good job, etc. It's just one extra thing to keep in your file, so it can be very helpful. The presentation is really pretty low stress, but it's a good opportunity just to show what you know. You have to do this once. There's nothing saying you can't do it more than that and bring more knowledge to your team. That's entirely up to you and your attending.
Okay, so there are going to be some educational activities happening while you're rotating with us. First of all, on Thursdays, we have our Cucarulo Club. Basically, we go over certain chapters or sections of chapters. That starts at 12:15 and it goes roughly around to 1 in the afternoon. On Fridays, we have our didactics. They're usually from 9 a.m. to 12. However, they can be earlier. Just be sure to ask your resident if there's any changes in the schedule. We have other education activities such as M&M conferences, journal clubs, grand rounds. Basically, ask your residents whatever upcoming education activity is going to happen. It's probably best to assume that there's something going to be happening at noon. So again, always be in contact with the residents. And we do have frequent workshops in the afternoon for our residents. Sometimes medical students are invited, but that is on a case-to-case basis. So again, contact your resident and just get clearance from them and make sure that it's okay for the medical students to go.
So for reading, there's a list of articles that we sent you prior to the rotation. We do recommend that you take a look at those. Mostly just a quick read through. You don't have to know every detail of it, but it's good to familiarize yourself with the topics we discussed, the terminology, the pathophysiology of things. Again, you don't have to know every single detail, but we have specialized conditions here. We use special vocabulary, and it's helpful to kind of familiarize yourself with that. Of course, your attendant can always tell you to do additional reading, and of course, we encourage you to do reading of primary literature or other things that contribute to the patients you're seeing. It enriches your experience and it enriches ours. So we're always happy to have you bring that to us as part of your practice.
Okay, so for absences, if you have any planned, let's say, for example, if you need to attend a special family event, please let us know before your rotation starts. And for any unplanned, as soon as you find out, we know things happen, just try to let us know as early as possible and email us, please.
Yeah, don't be too afraid to let us know if you need to take an unplanned time off. I think the policy is that if you're on a 2-week rotation, you're allowed to miss 1 day, and if you're on a 4-week rotation, I believe it's 2 days. But again, things come up. If you need to have something come up unplanned, you're able to make that up. For example, coming out on a weekend, if that's something you want to do. We've had students do that before, and it always works out fine. So don't stress about it. So what could your typical day be like on an inpatient rotation? Well, let's find out. So we start our mornings relatively early here, getting into LRC roughly 6:30 to 7 for you medical students on inpatient rotations is probably the best. Your inpatient residents are going to be getting there around 7 every morning because that's when the sign out occurs. The sign out just happens by email, but they start working. They're generally going to be meeting in the 5th floor workroom. That's room 5128. When you exit the elevators on the 5th floor, it's just to your right near the cubicles. You'll find your way there. Residents will be happy to show you. The main door does have a card access, but if you go around to the second door in the room, it's not locked, or at least it shouldn't be at that time in the morning.
Okay, so general tips while you're an inpatient. Keep in mind that this is not shadowing. Try to be as active as you can. This means writing notes. Again, be enthusiastic, as I mentioned before. Always be willing to learn, to ask questions, read before, and be in contact with your residents and how you can help them and whatever academic activities are happening. And when you get in, it's time to chart check. So in a nutshell, you can go over vitals, labs, any imaging that was ordered the day before, cultures, any other possible notes by teams. If it's a patient who has drains, you can check the input and output and the MAR summaries to see any changes in medications.
And then for pre-rounding, so you're going to do a targeted physical exam. It's probably a little more specific than what you'd be doing on a medicine or maybe even a surgery rotation. So the usual questions are just asking how they did overnight. Did you participate in therapy yesterday? How did it go? Have you been going to the bathroom? Number one or number two. The basics, any chest pain or shortness of breath if it's relevant for that patient. Of course, if there's something else going on with the patient, ask them about that. And then your physical exam should be really quite targeted. So we're not doing a full exam every morning. Just inspect the lower extremities real quick, listen to the heart, lungs, and abdomen in one motion, and then monitor other relevant parts of strength of the neuro exam for changes. Say, for example, they have weakness of their left arm from a stroke. If you're checking on that just briefly every morning and you're able to compare from day to day and say, hey, they're getting stronger, or maybe they're not improving as fast as we expect, that's also important for us.
Okay, so next, let's talk about rounding with your attending. This can vary. Some attendees like to round early morning. Others, it can really fluctuate on a day-to-day basis. Some can even round the afternoon. So it really depends on the service.
As soon as you're done with pre-rounding and you have some time, it's probably a good chance to start writing your daily progress notes. You can prep these in the morning and save them for later, just so you can quickly update them at the end of the day before you get started with admissions. Our workflow during the day is a little bit different than some other services in that most of our admissions are going to be coming in the afternoon, sometimes a little late. So it's important to conserve some time at the end of the day for that to happen. Getting your progress notes done efficiently by the early afternoon is always ideal. If you can get them done before lunch, that's great. If not, make sure they're at least drafted so you can get them finished up real quick when you come back.
Okay, so next, let's talk about lunch.
Lunch.
Yes, yummy. So after you round it and you roll your daily progress notes, you can go with your residents to the cafeteria, grab some lunch, or if you bring your own lunch, if you meal prep, great. Just take this time to unwind and just relax for the time being.
Generally in the afternoon, the most pressing thing is going to be working on admissions to your team. The way that admissions work at LRC and in rehab in general is quite different than admissions that you would get on medicine or other services. We get a list, usually starting in the middle of the afternoon, of all the potential people who could come that day. And sometimes that list can be pretty big. So we work on preparing the admissions, that is, creating an H&P. We work on setting up the orders ahead of time. So if the patient is approved to come to rehab and they do end up coming that day, that we're ready. So the goal is when you get that list, you want to start prepping those people who are most likely to come, knock it out. If they get confirmed to come, then that would be when you and your resident would go and see them in person and evaluate. You don't have to go and evaluate everyone who's on that potential list, just the ones who are actually coming that day.
Okay, so here are the services that you're going to be rotating as an inpatient. We have cancer, spinal cord injury, stroke, comprehensive, and brain injury. We provided the names of the attendings as well as their emails for your convenience.
All right, so if you're going to clinic, the ones in LRC are on the second floor. Those are just past the gym on the left after you exit the elevators. If you're going to the pain clinic, where Dr. Price works, for example, sometimes Dr. Alicia and Dr. Chu, that's located on the ninth floor of the Don Sofer Research Center. That's like across campus from us to the south. For the outpatient clinics, that's often at what's called UMHC, which is a curved building attached to the Sylvester Comprehensive Cancer Center. There's a map at the end of this presentation that will be able to show you a few pictures. If you're scheduled to go to the VA, which is kind of a new thing with us at the moment, that's only for Miami students who've already been approved and have their access. That's in the first floor specialty clinic area. The first floor of the VA, as you may know, is a little bit of a maze, but you'll find your way there. And if you're scheduled, you can always ask the clerkship director for more specific directions.
Okay, so your resident and the attending will let you know about the dynamics of the weekly clinic. Basically, when starting clinic, let your resident and attending know what your experience and comfort level is seeing patients on your own. Particularly, obviously, rehab patients. For example, if this is the first time, or if you have some prior experience, we can help sort of tailor this whole clinical experience to you. So important contact information. We've gone over this before, but let's just retouch on some important points. Um, Always contact your resident clerkship director if you have any questions. Like for example, where am I going? Who am I supposed to be with? Who is my resident? Please get their phone number when you arrive to LRC on the first day. For any questions about administrative issues, badging, credentials, electronic medical record access, please contact Carita. And the clerkship director is Dr. Prince.
A couple things I want to show you on this map. So this map is a little bit dated, but it's still one of the best that we have. This map is actually from before the rehab building was built. Let me just show you a few things here. So this here, the big circle, that's where LRC is now located. They demolished the old rehab hospital here and rebuilt LRC in the same location. So that's the main location you're going to be working at. When you look out the windows, you're going to be looking north and south. If you look south, you'll see this older building, the Mailman Center across the way. Past that is the UMHC clinics, this curved building that's attached to the Sylvester Comprehensive Cancer Center. Sometimes you'll have clinics both in the south end of the cancer center and in the UMHC clinic building. The Don Sofer Clinical Research Center, where the pain clinic is located, and sometimes Dr. Tu and Dr. Alicia also work there, is down here across Northwest 14th Street. So if you go straight south from LRC past these buildings, you'll find your way there. It's the tall glass one. It's also where the gym is on the 9th floor. Most of the clinics are on the 9th floor next to the gym center, which is where the medical students and other faculty can work out. Also here, just to show you, if you go west across Northwest 12th Avenue, that's where the VA is. It's pretty big. It has a big VA on it, so you can't miss it. University of Miami Hospital is down here, as well as Jackson Medical Towers. The other main, of course, biggest thing here is Jackson itself, which we're attached to. We're attached to a hallway that goes between the two. Jackson's main building is right here. It extends way out here to Ryder Trauma Center at the far east end of campus. It comes all the way back around to Lynn Rehab Center. It's actually organized in a pretty interesting way. So, when patients first come in for a traumatic injury, they enter the trauma center, they get stabilized, they work their way through here. Sometimes they go to intensive care. The medicine floors are right here, and then they work their way over here. So when someone comes in for a traumatic injury, they often work their way from east gradually to west and end up at us before they go home.
Okay, so while you're with us here in LRC, we do expect you to work hard, but please, please, please enjoy yourself and experience Miami. I mean, it's a beautiful city, many things to do. There's Wynwood. It has an art district. It also has a lot of breweries, so that's pretty fun on the weekends. Miami has a lot of outdoor activities as well, mainly boating, kayaking, some of the parks. You can rent kayaks and go around. There's South Beach and there's Miami Beach. Those are typical landmarks, so please be sure to visit those. We have a lot of restaurants. The nightlife is obviously very active here in Miami, so please enjoy yourselves.
Yeah, I mean, whether you're a native or you're new to Miami, there's always something new to do, whether you like outdoors, indoors, nightlife, or something quiet. There's something for everybody here. And with that, we want to give you guys a big thank you for coming to rotate with us. Whether you're in PM&R or not, we're happy to have you here. and we look forward to giving you some clinical knowledge that you can take with you wherever you go.
Yes, may this be a very fruitful academic experience for you. We hope you enjoy it over here, and we wish you best of luck in your future endeavors.